Welcome to Rhythm, Music, Singing, Dancing, and the Brain. A few notes on some selected research from a person living with Parkinson's disease. Our outline will be what is the Parkinson's, or PD, what does current research say, generally speaking, what does the research on rhythm, music, singing, and dance so far tell us? And without getting into providing any medical advice, what should a person with PD do? So, what is the Parkinson's? If you've read any of the research or heard about it, you know that it's incurable at this time. It's progressive, meaning it gets worse over time. It's degenerative. It's a neurological disease, meaning it affects the neurons in your brain that control your motor movements. It was first described by James Parkinson as the shaking palsy in 1817, and later the name Parkinson's was attached to this syndrome or disease. Clinical diagnosis of Parkinson's is still based on the observation of these cardinal symptoms that were described over 200 years ago: bradykinesia, or slowness of movement, and at least one of the others: resting tremor, rigidity, postural instability, balance problems. In 2015, however, the Movement Disorders Society published an article showing their research on prodromal symptoms and diagnostic criteria for the purposes of research. And last year, a survey indicated that even though these were very good and comprehensive criteria, that most practitioners were still not using them. So the takeaway for people who think they might have Parkinson's is make sure you're seen by a movement disorder specialist who is up to date on the research. Prodromal or preclinical symptoms include sleep disturbances, most especially REM, sleep behavior disorder, in which people act out their dreams. It has the highest predictive value of about 80%, eventually turning into Parkinson's. Mood disorders, major depressive disorder, and more recently bipolar. About 50% predictive. Hyposmia, or loss of sense of smell. Constipation, which is related to autonomic functions. And cognitive impairment. Combination of any two prodromal symptoms increases the risk by 4 times. And essential tremors has been linked with Parkinson's through the LINGO1 gene, increases the risk of both of these by 2 times. Although previously, essential tremor and resting tremor were treated as being entirely separate. In general, in a review by the Movement Disorders Society, they found that evidence-based treatments for motor symptoms do not delay or slow down the progression of motor symptoms. And the options for treatment do continue to expand, so levodopa, deep brain stimulation, other forms, other drugs can help make life more bearable. And there was no evidence or insufficient evidence that physical exercise or any of the other complementary therapies helped. So, summing it up, exercise has not been shown to slow the progression of PD symptoms in general. Exercise is good for your health, for your body, for your mind. All forms of exercise do improve cognitive functions. Anaerobic exercise in particular improves your memory functions. But is exercise enough? So let's get on to the fun: singing, making music, and dancing. As far back as 2000, I found an article on active music therapy that included choral singing, voice exercises, rhythmic and fine body movements, and active music making, including collective invention, and significant differences were found in bradykinesia, and physical therapy improved rigidity, and surveys also showed that activities of daily living and quality of life were improved. In 2006, there was a study of professionally conducted choral groups in the UK, not Parkinson's patients. Overall health improved, fewer doctor visits, fewer prescribed medicines, fewer over-the-counter medications, and depression scale scores improved. So being in a singing group is good. And probably generalizable to people with Parkinson's, although this study did not include them. In 2010, there was a study on therapeutic effects in neurological disorders that included Parkinson's and other disorders. They did use neuroimaging so that they could see what was happening inside the brains, and found that singing helped to regulate speech, improve both cardio and pulmonary health, improve expressive language, influence emotional regulation, and influence the mirror neuron system. James Levitin, who wrote This Is Your Brain on Music, co-authored a meta-study of 200 studies on the benefits of music in 2013, and found that music and singing engage the systems for reward, motivation, pleasure, stress, arousal, stimulates the release of dopamine, which is important for people with Parkinson's, reduces stress, increases oxytocin, which helps with social community affiliation, and can help modify autonomic systems. And for many years, rhythmic auditory stimulation has been a mainstay of music therapy with Parkinson's patients, in which an external cue of either a metronome or a musical beat is provided to help get a person moving so they don't freeze and so that they step along better. This study found that if you sang a song, you had significantly greater improvements in gait, stride, and speed than if you simply listened to an external cue. They didn't test whether in-your-head singing counted or whether any other song other than Row, Row, Row Your Boat would work. But Row, Row, Row Your Boat works. And anytime feeling a little wobbly, I tend to sing that to myself, sometimes out loud. Row, row, row your boat gently down the stream. Merrily, 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 life is but a dream. And this slide is taking an extraordinarily long time to go. Okay, in 2018, individual therapeutic singing intervention was reported on, and treatment consisted of vocalization, breathing techniques, larynx and voice exercises, and auditory feedback, in which the individuals heard what they sounded like, I guess. And the results were the maximum phonation time, or the ability to hold out a tone like ah, improved significantly. The voice handicap index improved, the voice-related quality of life improved, and the geriatric depression scale scores, all significantly different over the pre-treatment scores. So therapeutic singing that involves these things is good. Finally, making music engaging the whole brain. Drum PD, a study reported in 2016, West African drum circles were conducted 2 times a week for 6 weeks with a treatment group that significantly improved the quality of life scores and the connection with their peers, their community feeling. But after they came back after the study had ended, they found that quality of life had dropped down again. So you got to keep this up if it's going to do any good. And it might be noted that these were surveys and not hard data or imagery of changes actually happening in the brain. Also in 2018, a professor down in South Florida looked at what had been happening in music therapy for PD, noted that rhythmic auditory stimulation has not been shown to prevent cognitive decline, although it does help with mobility, balance, and gait, and so forth. But then singing, as we just found out, actually helps even more. So this professor had the hypothesis that keyboard training can improve your executive functions through generating neuroplasticity. The fine motor skills that are used in playing a keyboard, perhaps maybe a guitar or bass, who knows, can enhance cognitive performance. Music training improves the connections between the brain hemispheres, and there's the hypothesis that possibly creation of new neural adaptations to compensate for the decline of the normal frontal cortex to the back of the brain system. On to dance. Rather than go through a whole bunch of studies, a review was done in 2018. Dance practice integrates brain areas. Again, like keyboard training, it enhances the connections between both hemispheres of the brain. In neuroimaging, they found that there was increased volume in gray matter and increased integrity of the white matter of the brain, which is pretty good. And functional improvements were measured in memory, attention, body balance, social connections, and so forth. And this was a summary of many studies. And then just before I finished putting this thing together, came across this article. Dance training, as done in this study, was superior to repetitive physical exercises in inducing brain plasticity in the elderly. Not Parkinson's patients, but probably generalizable. They did extensive pre- and post-assessments of cognition, attention, memory, posture, cardiopulmonary performance, neurotrophic factors. They used MRIs. And the results were that both dance and physical exercise, repetitive physical exercise, do improve physical fitness. But the differences were seen in brain volumes only in dancing. And large volume increases, instead of shrinking, of the brain areas were seen in the dance group, which was a 6-month period. And only dancing was associated with an increase in plasma brain-derived neurotrophic factor, BDNF levels. You can look that up on Google. And both physical exercise and dance improved attention and spatial memory, but no significant difference between them. The authors hypothesize that maybe cognition changes come after structural ones. So basically, much of the research on music's impact on the brain has been musicians versus non-musicians. Few involve people with Parkinson's. Much of them are limited to affect, mood surveys. We do need studies into the effects of music, dancing, and singing interventions on the brains of people with neurodegenerative diseases, and we need studies into individual treatments as well as combinations of different types of treatments: singing, dancing, playing musical instruments alone or in a group, collective invention, improvisation, and so on and so forth. That's my opinion. So, to repeat, a lot has been learned about Parkinson's disease since 2012, which is when I got my deep brain stimulation implants. For instance, all this information about prodromal and predictive symptoms. There's still a lot to be learned. We've barely scratched the surface. Exercise by itself doesn't delay the progression of PD, and not enough research has been done with rigorous methodology and information on brain functions to say what the impact of dance, music training, and singing is or could be. And in theory, music, singing, and dance can help build new neural connections in the brain. So, to borrow from Fleetwood Mac, don't stop moving to the music. Next slide, please. So again, this is not medical advice. The presentation here is biased towards the hypothesis that music, playing music, singing, dancing, improvisation are all good things to do, whether you have Parkinson's disease or not. And to repeat, music, playing music, singing, dancing, and improvisation or collective invention are good for you any age, any state of health, just about any time of day, unless the neighbors complain. So this ends this presentation as of June 4th, 2019. It may be revised in the future. Research will continue. And please do support research and programs that provide services to people with Parkinson's disease.